And welcome back. Dr. Zoe Stallings, a family medicine physician with Cone Health Medical Group, is back with us. We are answering your questions about the coronavirus. Remember, you can text any questions you might have to 336-379-5775. All right, Dr. Stallings, I love this question. Someone says, what is the proper way to wear a surgical mask? Does the blue side need to be out? Does the white side need to be out? And I think that you are just the person to ask about this because you have an awesome demonstration.
Yes. So what I typically say is that the blue side should be out if it's a traditional blue and white mask. However, they can come in a variety of colors. You can have some that are gray on the outside. So if you're wearing a surgical mask and it's blue, white should be on the inside, blue on the outside. The important thing is do not confuse them, because if you switch it halfway through the day, you have now put the contaminants on your face. So if you're not really sure, as long as you keep it consistent, that's okay, but the blue side should be out and the white side, the clear side. So when you look at a clean mask, I'll show you here. See how that's white? This is blue. So you want to make sure that you open your mask up, holding it by the strings, looping it behind the ears, tucking it down right there so that you get a good, nice seal. Blue side out, white side on the inside against your face.
Yes, thank you again for showing us that. That same person asked Dr. Stallings, do I need to wear the mask when I have the virus?
Absolutely. Absolutely. When you have the virus, you wear the mask. You stay in your house. You don't leave. You order things and they deliver it to your doorstep. But we want you to actually isolate yourself and wear your mask if you have to go to a doctor or a clinic or to get a checkup. Now, if you're in the house and you live alone, that's fine. If everybody else in the house is also infected, you don't need a mask, you all have it. But once you are going into the public world, you're going to get other people sick. You must wear your mask at that time.
And that's why people, even if they don't know they have the virus, still need to be wearing a mask, because we could be what we call asymptomatic, not showing symptoms, not know that we have COVID-19.
Absolutely. And unlike other viruses where people have sniffles and coughs and body aches, I have patients who have felt well, that were just tested as a precaution for a surgery or a procedure, that were positive and had no symptoms and no concerns. So wear your mask all the time.
And welcome back. We are up and running again with Dr. Zoe Stallings answering your questions about the coronavirus. She's with Cone Health Medical Group's Family Medicine. You can continue to text her questions to us, 336-379-5775. Dr. Stallings, I hate we lost you on that last question about gloves because I want to know the answer. Do we need to be wearing gloves when we go out and about?
So I personally, I wear gloves at work here all the time. They're single use. The moment you touch something, you have now contaminated the gloves. So if you're not using them as single use, you're using them incorrectly. What you're doing is you're touching multiple surfaces. You're now contaminating everything you have touched. So gloves are disposable and they are meant to use one time. You touch something, it's over. So I see people and they touch their car door, they put the gloves on, they're in the grocery store, they're in their pocket, they're at their purse, they're looking at the cell phone, and they're touching all these surfaces. They've contaminated everything. And so also it gives us a false sense of security. I was wearing my gloves, so I don't need to wash my hands. You do. You need to wash your hands. And so what we need you to do is just understand that this virus is still a respiratory droplet virus. However, you can get contact with surfaces. So we still want you to use hand sanitizer or soap and water and wash your hands. A glove will not replace that.
Yeah, very good. Someone writes in, my employer is offering free testing for COVID-19 for people who have not been exposed and people who do not have any symptoms. They're just wondering, how is that beneficial?
Well, you know what? I think that it's helpful, because if we could find all the asymptomatic people, the people without symptoms who are walking around feeling fine, and we could identify those people and quarantine them sooner, we could probably shorten the extent of this disease. So what I would say is, if your employer is going to A, test you, symptoms or not, and B, allow you to quarantine, that's a wonderful opportunity to get a test. So go ahead and take that test. Also, health systems like Cone Health, they do pop-up testing. They'll send out a blitz if you see it on TV advertised or on come, you can actually go and see where there'll be testing sites done. And those are usually free. You walk up and get tested. So it's not something where you need to have symptoms to be tested. It's just that while we had limited resources, we tested the highest risk people first, people who are going into the hospital for surgery and labor. But now that we know more about this virus, we actually want as many people to be tested as possible if you have access. So if your employer is going to do that, go ahead and do it.
Someone writing in, should I wear a mask when I'm walking in the park?
So let's say you're walking in the park and someone runs past you and coughs as they're running past. You're not protected. So my recommendation is wear a mask if you're in the park, because you're not the only one in the park. If you live on 10 acres of land and you have your own park, go without the mask. It's your property. But once you leave your house, you're out and about, you are sharing that space. Now, if you can look around and you don't see anyone, you can lower your mask and enjoy fresh air and take the mask off for a few minutes. But once you start to see someone approaching you, put your mask back on, because once again, people who are exercising are breathing very heavily, and you can come in contact with coronavirus that way.
Absolutely. Good to have one handy. Thank you so much, Dr. Stallings.